I'm Ken Leonard from the Research Institute on Addictions, and I'll be talking about some of the substance use. Okay, some of the substance use data tomorrow. I just wanted to raise an issue that I've studied violence since I was in graduate school, and one of the issues of definition becomes very important when you look at mental illnesses, because among the DSM major mental illnesses, externalizing disorders are almost completely gone. They're not in the major. They're in the axis 2 as explosive disorder and in personality disorders. But when we look at kids, we talk about internalizing disorders and externalizing disorders, and so there's not really a DSM equivalent of somebody who is anxious all the time and has an anxiety disorder, or someone who's depressed, sad all the time, but someone who's hostile all the time and sees threats everywhere. We don't have a diagnostic category for them. They sometimes end up on our antisocial ones, but it's a marked difference in the way we deal with angry affect versus we deal with any other kind of affect, and we won't put it into that mental illness category. When we talk about people with substance abuse, you're often talking about people who have both a substance use problem and the acute and the chronic problems of that, plus the externalizing portion of that, which we've completely missed when we look at the other mental illnesses. So that was just the comment I wanted to make.
It's a very good comment. Is there an implication from that? Is there something you think we should do or refocus our efforts in a certain way?
Well, I think there's a lot of implications to that. I think one of the implications of that is to think more about how you can address this notion of a disorder that nobody's named, which is this hostility and threat that people see when there is none. I mean, you can make the case that that's some of the things that have been happening in Florida, in terms of the 2 killings down there. You can make the case in lots of different areas that this is a disorder that we ought to be focused on and be thinking about how you can treat this. It relates to everything we talk about. It relates to suicides, it relates to substance abuse, it relates to violence. So I just think that for the entire time that I've been studying this, the notion that we deal with people who are depressed as having a disorder that we treat, and people who are anxious with a lot of sympathy, and people who are hostile as we don't want to deal with them, they're criminals, is fundamentally wrong. It's an affect regulation issue, and we ought to be naming it that and trying to figure out how to treat that.
Well, thanks. I know that one of the hardest things for people who take care of parents with dementia is frequently when the parent becomes angry with the caretaker and turns on them and makes them the target for their hostility, anger, and sometimes violent outbursts. But I think you're helping us to say that this is a very important area that needs more attention and help. Xingxi?
Thank you, Mark. It's more of a comment. Knowing Paul's work, and I think your comment about Lapierre's, right after his comment, NRA, I found out fairly recently, started a very aggressive campaign to sell guns to young kids in this country. Last night, I was having 3 espressos, too many. HBO, Brian Gumbel did a story on Unreal Sports where he highlighted that last night. In 7 states in the United States, there's no age minimum requirement to purchase a hunting rifle, while many other states, the age limit is 10. So while a young kid cannot go to a store, buy liquor, cigarettes, buy lottery tickets, they can spend a few $100s, buy a rifle. One of the fastest growing segment of gun-related injuries is in-home with infants and young kids in this country. And I think it really, if you have not seen it, I highly encourage you to watch this episode. It's quite alarming, and I know it's something Paul would want to share about.
Thanks. We'll come back to that. We have a panel on means this afternoon, and I'm sure the discussion will heat up, but talk about some of these same issues that you raise. Yes, last.
Hello, my name is Ronaldo Laranjeira. I'm from Brazil. And I'd like to know your views on what's going on in Colorado and Washington with the legalization of cannabis, and what would be the impact of this change of cannabis prevalence on violence?
It's a very good question. I don't have the answer, but maybe it suggests that we should pay attention. Do you have the answer to his question? Short. Do you have a short answer to his question?
Sure. Patrick Fox, Interim Director for the Office of Behavioral Health for the state of Colorado. So I can, I didn't bring samples. I can tell you that we're looking very closely and have asked that the excess tax revenue that's going to be generated, we had initially thought about $97 million a year. The most recent projections say it's about $150 million a year in excess state revenue. That about $34 million of that will be put toward substance abuse prevention and treatment for youth, and specifically also looking at any correlation between an increase in incidence of psychosis, because the model suggests that cannabinoids can be a trigger for new onset psychosis or an unmasking of psychosis in someone with a genetic predisposition to it, as well as rates of violence, both in the community and within school systems. So it's an interdepartmental project that's going to be directly speaking with school safety officers to gather information about whether there's an increased incidence of both truancy and aggressive behaviors in school with the introduction of marijuana into the general population now that it's legalized.
Well, thanks very much. I'd also ask that you look at the impact on interpersonal violence, intimate partner violence in homes, and assaultive behavior among kids, suicide as well, and self-directed violence, and those things that Eric called before. I forget, what was that A word? Accidents or people crashing into others on the highway, motor vehicle crashes, but good. But I think that's very exciting that you're going to be looking at this, and those data are so important, so I applaud you for that. Let me take one last question, then I better introduce our next speaker.
Mark, very nice job of giving somebody else's presentation, by the way. That was very nice. I just wanted
intellectual property theft, Jim.
I just wanted to make the point that this was all about the contribution of interpersonal violence to, or mental illness to interpersonal violence, but I think we also need to recognize the huge contribution that exposure to violence makes to mental illness. I saw a recent systematic review globally done that said that that relationship meets causal criteria for physical abuse in children and neglect. So I think violence prevention is actually promotion of mental health. And so that's an important other aspect of the relationship that needs to be emphasized.
And that's not something that gets asked about, because what people ask about is what are the consequences, the immediate consequences of your violent behavior. But I think Jim's point is that if you have parents who behave in a violent way towards children, or non-familial people who behave in a violent way towards children, it can have lifelong sustained damage to those children. And in the past, we've not considered that as part of violence. And so a huge part of this definition that we need to improve on and expand to measure the real impact and incidence of that, ultimately to know how much better we could do and how much more we could prevent. I'm very glad that the questions are heating up and the discussion is getting engaged, but I saw my red light flashing. Unless I want to be the victim of violence from Kimberly, I need to move us on and keep us going. But we will have more time for discussion, and welcome your interchange with all of us. I want to introduce Jim Blair. Jim is chief of the Unit on Effective Cognitive Neuroscience at NIMH, and his primary research interest involves understanding the neurocognitive systems mediating affect in humans. I'll say that 3 more times. The neurocognitive systems mediating affect in humans. It's what we usually think about several times during the day. but it basically says, what are the biological mechanisms in the brain that control our feelings and our responses to those feelings? Can we actually understand the brain well enough to understand some of what goes into the violent behavior that we see? And he's interested in how these become dysfunctional, especially in mood and anxiety disorders. His primary clinical focus is in understanding the dysfunction of affect or mood-related systems in youth who have specific forms of conduct disorder. To me, this is taking what has been for years and centuries, basically a black box conduct disorder in children, and saying, do we have the potential to actually understand the neurological basis for these problems? It's very, very exciting, and I'm pleased to introduce a member of our planning committee, Jim Blair.